what came to mind when I saw how we've stacked our services here, and it just happened by accident, really. It's almost like we've got Maslow's triangle.
Yep.
Because
Yep. The path to enlightenment at the top.
right. It's like when you're feeling stress, when you have chronic pain, it's hard to go to the higher levels because you're dealing with an issue that is bothering you constantly, and it's almost like, on the other hand, it's very important that we see ourselves as not just helping someone to become physically healthy,
Yeah.
but that there's a purpose, and that as people that we work with become healthier and more conscious of their health, and more at peace, and happier, and their relationships are going better, that's a time when they're going to be asking these types of questions. Okay, why? What's it all for? What is my legacy? What do I want to create on this earth? And that's where Annie is the natural next step. And sometimes it can work the other way around, where if we're having if we're working with someone in some area physically, and they're just having trouble, there's kind of a blockage, they won't lose weight, or the chronic pain won't go away. It's it's amazing how, when somebody is lit up with a calling, it can totally revolutionize their physical situation. And so I think this really comes hand in hand, and that's part of how Annie could be a very integral part of what we're doing. Um, I think in terms of my running, the only reason, and I've known this for ever and ever, the only reason that I have continued running is it's not a workout. It is more of a spiritual experience. If it were not a spiritual experience, I would not be able to maintain my running. I would not be able to maintain my health regimen, because that's what really fires me. It's the deep spiritual experience that I'm having when I'm working out. And so it's all interconnected, and our society has divided things up so much. But that's enough for me to say here at this point. I'm just looking for connections, though. I'm looking to see how we all integrate as a wellness center. Um,
We have doctors for the mind. We have doctors for the body. In our culture, we don't embrace the doctors for the soul.
mhm.
And that's really the role that I play in this health piece, is the spirit, the soul healing and the discovery.
Well, that's something that I think each of us might want to explore with you, Annie, just to get a feel for what that means in our own lives. And that would help us to understand ourselves better and understand what you do. Um,
Yeah, and I think Annie touched on something important. And when we're looking at the five pillars of health,
yes.
uh, it became very quickly became very obvious that it was a lot leaning towards the nutrition, the physical, all the obvious stuff. But when it came down to the spiritual, in our society, there's not a lot of options. As opposed, you go somewhere like India, and it's the inverse,
Mm-hmm.
right? A very spiritual culture, right? And so you can see the contrast and the differences between, uh, well, when you put all the pillars out, you see that it has to be balanced, right? not one is more important than the other, and they all have to be addressed. So yeah, I agree with Annie.
You could take one thing like depression. Okay, if you don't know what your purpose is and you don't know what your future holds and you do not have hope, you may be depressed. If you're depressed, you're more likely to eat a lot or to starve yourself or to experience chronic pain.
Yeah.
And so that can all turn around when a person comes in touch with their calling, and it affects each of our, the work of each of us. I've had lower back problems when I'm depressed.
Yep.
And it's not just because of my running. It's not because of my shoes. There's not a physical cure for it. It's because I'm depressed. And when that depression is overcome, when I get more in touch with my purpose, curiously, my joint pains begin to dissipate. So
It's all
interesting.
linked.
We have people come to us seeking a certain resolution of an issue. And what happens is a lot of times we all go so deep. Even if it's Gus with your physical and the emotional comes up, and even if it's with yoga and that emotional part comes up. And with Annie, it definitely brings up emotional releases. And I think all of us work on that level in our own ways. And I see that common thread through how it manifests in our lives.
Yeah, I'm starting to get an analogy of what value we bring to the community. It's
Mhm.
almost like this is a house of health, and this
Mhm.
house of health has many doors, right? uh, I'm in a toxic situation, and I can enter through any of these doors to get to a better place of health. I can go through
Mhm.
Annie, I can go through Denise, I can go through Holly, I can go through Michelle, and each provides value and provides a lot of overlap as well. Like, for example, someone is in physical pain, right? They go to Denise, they change their eating habits, they start doing yoga. That might be enough to get them out of pain, right? That might be enough to where they become active again and they're working out, they're going on walks. That might be all that they need, right? But if it comes to a point where they're having a challenge with recessed memory, then Denise can then refer out to Annie, right, or to Holly, right? So there's a lot of value that each one of us can provide, and for any added assist that is needed, then we have our colleagues that we can refer out to and get some assistance with.
And I think when I think of Denise and Holly in particular, I think of the connection to traditional medicine also, because you have both served in that capacity. And there comes a time where people may need to bridge those two in some cases. And how do we know? I wouldn't know where
Right.
that point is. And
There's a
maybe,
lot of value in that.
yeah. So that is something really valuable in itself too. This brings to mind something else too, Gus, that we can learn from one another and from our approaches. So I like your systematic approach. And some of us, like if you're talking Holly and Annie, you'd wonder, how can they have a systematic approach? But perhaps to see what the more intangible we are in how we're working with people, and the harder it is to describe. That calls for trying to make it more tangible so the people that don't even have us on their radar can understand, because the average person works in the world of tangibility. And the further we are from that, the harder it is for the average person to relate to us or even understand what we do. And I think some of these systematic approaches can really help us in our work with people. Of course, you can't objectify it to the point of becoming a commodity and some kind of an assembly line health system. But I think we can learn from those who have a very tangible practice, those of us who have a less tangible practice. I mean, the things I spoke about last week, spirituality. And when I think of Holly and Annie, and to some extent Denise too, that we can really benefit, and we can become more accessible to the public by to the extent that we can incorporate some of these systematic approaches. So just a thought.
I completely agree with you. And the simplicity that I just mentioned came after years of seeing the advantages, seeing how best to help the public with these therapies, and trying to
Yes.
explain to them, right? This didn't come to me easily. But that being said, I think I have from everyone on this call, I think I have the easiest job, right? Because I'm dealing with, hinges and strings, right? We're dealing with joints and tendons, right? And muscles, right? Pretty straightforward, pretty physical, that's pretty straightforward. When you're dealing with nutrition, with spirituality, with, where a person is emotionally, that's deep diving, right? That's a conversation. That takes a lot more and is more nebulous, right? I think the payoff is bigger, right? Because it's very impactful, right? But it's challenging to explain that to the public, the benefits of it. You go to one memory and change, you reframe it, and all of a sudden things open up for you, right? That's a big deal. That's a big payoff, right? But you gotta work on it, and it's not straightforward as
Well,
working with somebody's body.
one of the examples you gave a moment ago, Gus, was Tony Robbins,
Yes.
who, motivation is something that is an intangible. How do you motivate someone? And he makes it very simple: stand up straight. And I think to the extent that we find those connections, that we become more accessible to the people that we're serving and the people that don't know about us.